In 2018, the Ministry of Health adopted the Young People and Adolescent Peer Support Model, a person-centered care approach for adolescents and young people living with and affected by HIV. The AIDS support organization, known as TASO, was one of those implementing partners that piloted this intervention at its Soroti Region Project on accelerating epidemic control in Soroti Region through attainment of UNAIDS 95-95-95 targets.
The Yaps model, or what we call the Young People and Adolescent Peer Support-led model, is a differentiated service care model. This is a model that is targeting the adolescents. The adolescents here, we are looking at the young ones who are aged 10 to 19 years, and then the young people who are aged 20 to 24 years. The center of this model, we look at the peer leaders taking charge of managing their colleagues, taking charge of seeing them through their care cascade.
Overall, the Soroti region has achieved most of the UNAIDS target in other age categories. For age categories 25 and above, you find that the 95-95-95 targets have been achieved. However, we are falling behind with the age category between 10 to 19 years, and these are the adolescents, but also these are the same age group that graduate to 20 to 24, and this is where we are having the gap, the biggest gap in achieving our 95. So our special attention is actually in this age group, and the Yaps program is targeting specifically the age category 10 to 19 for adolescents, and then 20 to 24 for the young adults.
David Eliru, a Yaps attached to TASO Soroti Center of Excellence, is one of the 41 Yaps who are currently actively engaged at 20 high-volume health facilities in the districts of Soroti, Serere, Kumi and Katakwi. With facilitation of a bicycle from TASO, David rides to different schools and homes to deliver drug refills for students living with HIV. He does this work with passion to help his peers to live positive and healthy lives.
I basically came here to support my AYP. We encouraged them to come and facilitate, but this is because he's busy at school with his exams, so he couldn't come there and pick his ARVs.
Joseph Epudu, a second-year student doing a welding course at Uganda Matters Vocational Training Institution in Soroti, acknowledges his life changed after he got exposed to Yaps. Epudu says he is now optimistic that he will live to achieve his dream of becoming an excellent welder in the future.
For sure, David normally comes and just advises me, my brother, keep on not swallowing your medicine. You'll become healthy and you'll achieve your goals in future. Whatever thing you need in this world, you'll achieve.
The story of Epudu is similar to that of Erao Godfrey, who is supported by a call Marion Kevin attached to Princess Diana Health Center 4.
You've seen me now, you don't see HIVs in my life. As I'm talking here, you've seen me. I have my family, I have my wife, I have now my son. He's very okay, he's very happy, and I take her to the hospital where my Yaps is, and the castle nurse from there is happy up to now. We stay.
In Kumi district, Harriet Amongin, a Yaps attached to Atutur Hospital, spends time to provide peer support to the young adolescents living with HIV and their parents.
The duties the Yap does from the facility is to help those young adolescents to fill their books, tell them the next appointment of coming to pick their drugs. I do help those ones who were also HIV positive to encourage them how to take their medicines and to encourage them how to keep their appointments.
Having received peer support from Yaps, Salome Agwang, a 16-year-old in primary 6, says she has been encouraged to swallow her medication and will be able to complete her studies and achieve her dream of becoming a nurse.
Some sister come to tell me how to swallow, keep myself safe He told me continue education.
As part of their service package, the Yaps also help the health workers in tracking and following up clients who miss their clinic appointments and encourage them to return for continuity on treatment, known as COT. In doing so, the Yaps inspire their peers and other members of the community to live free and purposeful lives. Alungo Martha, a Yaps attached Sorori Health Center 4, is an example of a change agent in her community. She attributes her motivation to change her life and inspire the communities to engagement as a Yaps. Mzee Okello Richard, the LC1 chairperson for Akumoi 1 Village, Kidetok Town Council, Sorori District, where Martha lives, testifies that Martha is a role model in inspiring the rest of the young people. He says the Yaps program that has trained Martha is a very good one and should be replicated by the other organizations.
If that girl shows a dress to these ones, that the child, the girl will look very beautiful, and that's why we find that we like Martha. I normally tell her that this early marriages and stigma and the younger ones doing such things during the late hours, we must be advising, because when I talk, they may fear, but very many of them are very close to Martha. So she's a very good girl, gives a very good message to younger girls.
At TASO Soroti Center of Excellence, there is a special clinic for children, adolescents and young people. During that clinic day, Yaps support their health centers to serve their peers whom they engage in a number of activities aimed at motivating them to live healthy and meaningful lives.
Feel free to talk to my doctor, isn't it? When you go inside, so they will tell you what can give you what best fits you, isn't it? And you'll be able to decide for yourself good things for your life.
The Yaps model is built around the life of young persons, and it integrates other important packages for the young people, including economic empowerment, sexual and reproductive health, nutrition and prevention of gender-based violence, among others. The implementation of the Yaps model involves district-level planning and multi-sectorial coordination at district, sub-county, and health facility level. There are mentors at each of these levels to support the implementation of this intervention.
As we are aware that HIV is ravaging our communities, and the people that are affected are the adolescents, the age between 10 to 24 years. Most of our caregivers in the facilities, you find some of them are old, some of them are young. So when these adolescents go to the health facilities, they are not able to interact with the old people properly. So when we identify that gap, of course together with the TASO, we identified the young adolescents who were already living positively. These Yaps have played a greater role. They identify the youth, those between 10 to 24, those who have come. They help them to be attended to in the clinic faster, because some of them have those stigma, they have the fear. So sometimes they need their peers to help them, link them very fast.
The Yaps model is a real game changer in the care package for young people living with HIV. The TASO experience with the model has shown tremendous results across the HIV care and treatment cascade.
Before the introduction of Yaps, TASO Soroti Region was implementing services to adolescents through a peer leader, but this was one peer leader for the entire facility. And as we began the program, the first 90 for adolescents was at 66%, and this meant that we are missing about over 1,800 children and adolescents that we needed to identify and put on ART. And the coverage of adolescents was still having a gap, overall gap of over 1,400 clients. Now, this was a coverage of 68%. And when we introduced the Yaps, this started as a pilot. We first tested this at 5 facilities to see the outcome that would come. Then after 1 year, we scaled this up to 20 facilities and added more Yaps. And in these 20 facilities that have been implementing the Yaps program over the last 2 years, we are seeing tremendous improvement in both case identification and ART coverage among the adolescents and the children. We have moved in these 20 facilities. The case identification, we are having a linkage of 97% of adolescents and young people identified being linked on the same day to the ART program. And for the second 90, we are now having a viral load coverage of 98% among these adolescents in the 20 facilities. And viral load suppression overall, in the 20 facilities, they have been able to achieve their viral load suppression. Viral load suppression is now over 95%. So the Yaps program is actually working, and we want it to be scaled up to other facilities, because this is the only way we are going to close the gap in case identification and also improve viral load suppression among this age category.
The work done by the Yaps is known and is well acknowledged by the district leadership in the district it is implemented. They believe the Yaps innovation and its mode of continuous engagement of district structures will underpin its sustainability, and it will remain as a pillar in the transformation of lives of the young people living with HIV.
As a local leader, first of all, the Yaps program is one of those key programs that benefit the local population, mostly the young people. I have seen now young people coming up openly to advise and to accept, and they go on and freely live positively now, which is giving young people more life. They live longer life, they live normal life because they have accepted. And this is generally because of the Yaps program. The only appeal I have on the Yaps program, that we should now see how to scale it down, have it in all schools. Like now in Soroti, I would believe would have small clubs in all the primary schools, secondary schools, come to the universities, so that it becomes part of the structures of the young people.
There is some bit of success in the program, although there are challenges also. And I would say these activities are ongoing, especially down in the selected areas where these youths are. We are happy that we get support from TASO, particularly for this particular program, and which is being implemented in the district under the Department of Health.
If we want to eradicate or eliminate, or we want to stop HIV, we need to intervene at the child state and the young adult state, because at the end of the day, by natural elimination, the old persons will go. But these are the people who will remain to either propagate the problem or decrease the problem. So I really recommend this intervention to anybody, that this works. If we approach it at that level, we will surely be able to achieve the target of reducing HIV spread. The Yaps model works. The Yaps model achieves results. The Yaps model needs to continue.
Feedback from the key stakeholders, partners, the communities and beneficiaries of the Yaps intervention concur the intervention as a great innovation in person-centered healthcare and should be replicated and scaled up in similar ways in all health facilities.
Yaps have helped the district to reduce a suppression of viral load on a population of 10 to 24. because these people were not coming and accessing the care. But because of the Yaps, these people now have freely come to the unit and access.
This model here has helped us as a facility. We have seen it work, and we believe that if we continue with it, then that means our Yaps will grow up and come and replace us also in these offices that we are in. The Yaps model is a good one that we need to adapt in all our districts, the countries, so that we will be able to help the young ones to become the persons that we want in the future.
The Yaps model has been a game changer as far as our adolescents and young people programming is concerned, and I personally recommend or would recommend that it is scaled up anywhere that you are having AYPs in care to harness its benefits.
I am proud to be a Yaps, beautiful as I am, and a champion.
I am happy to be a Yaps who strengthen young people.
I am happy to be a Yaps because I've changed the life of young people.
I am happy to be a Yaps. I am a champion of young people living with HIV.
And together we are in the center of accelerating epidemic control in Soroti Region.